Okay, well, first of all, thank you for the invitation from Artificial Intelligence Surgery to speak to you today at this conference, which is the Chinese Anti-Cancer Association International Conference. So limitations of artificial intelligence surgery, specifically in hepatobiliary and pancreatic surgery, probably relate to the use of robotic surgery, because robotic surgery is a great platform for introducing artificial intelligence programs. So pancreatic surgery is one of the more difficult, technically demanding types of surgery, and therefore the uptake of minimally invasive surgery and robotic surgery has not been as great as in other types of operations and tumour groups. So I think that's probably the biggest limitation at the moment, and the challenge there is that we need to get more people trained on robotic platforms, and then we can introduce artificial intelligence surgery from there. Okay, I think there's a lot of advantages if we can use augmented reality during surgery. So that is using the patient's own scans to map onto the operative field the tumour and its relations to the rest of the organ and to the surrounding structures, particularly to the blood vessels as well. So one advantage it can offer is that it can offer organ preserving surgery. So if you have a very precise mapping onto an organ, such as the pancreas, the liver, the adrenal gland, wherever it may be, then you can preserve some of that organ and you can preserve its function. So that's one benefit. The other is in terms of safety of the surgery, you're getting a very close correlation with what the blood supply is, and that can lead to safer surgery and less blood loss. Hopefully that will then translate into better outcomes and better long-term outcomes such as survival. Okay, well, I don't know. There are different visions of the future, and certainly AI applications are becoming more common and more utilised in medicine, and I think the most optimistic view is that we will work alongside them. That's the most optimistic from the viewpoint of a medical profession who wants to have a career in the future. Certainly the saying is that doctors who work with AI will replace those who don't. So we must understand it, use it, especially if there's a clear benefit in terms of diagnostic accuracy or better outcomes in surgery. Will surgical robots using artificial intelligence eventually replace surgeons? Possibly. Some may say probably. Certainly cars can drive without a driver now, and I think there's probably a similar level of danger with an operation and the lethal weapon, which is a car. So it could happen, yes, but I think it will happen incrementally with perhaps more technically repetitious aspects of surgery being done first, such as suturing, anastomoses. But then everybody's tumour is very much individual, and that sort of dissection, yes, I'm sure robots and AI can learn that in the future, but that may happen at a later stage in the evolution of this process. Sure. Well, first of all, I would encourage young doctors, young surgeons in particular, to get involved in research. I don't think it's good enough necessarily just to do some operations without making any contribution to the field and improving the field for everyone. The usual important issues are try to find good people to mentor you, to encourage you, and again to try and not to be too broad, but to become an expert on one thing and be the go-to person on that one topic, and not to hop about from different opportunities and to see things to completion. And yes, artificial intelligence is really the hot topic of today, and a great opportunity for young researchers, young doctors to get involved in that aspect of research.